Okay, hello everybody. My name is Sandy Beach. I'm a local comedian from Albany, New York. This is my wife Jeannie, otherwise known as Jeannie Beanie Beach.
Yes.
Um, and I about 20 months ago suffered a sudden cardiac arrest, and I'm going to be having open heart surgery in about 5 days.
August 1st.
August 1st. And to deal with one of the complications that has arisen since the cardiac arrest that I had, which is termed, the type I had is called Takotsubo syndrome. Basically, I had a healthy heart, but a medication interacted with other medications, and which caused me to have a heart attack, which my wife luckily found me within moments of the heart attack starting. Um, and you can speak a little bit about.
Yeah. We were talking from room to room. She had complained of a backache, but she has some back issues, so that wasn't abnormal. Um, and then she didn't answer me, and my dogs were kind of like going crazy, barking. So I went into the bedroom because she had laid down, and she was gray and taking very shallow breaths, didn't respond to painful stimulus. So, as a nurse, I'm ACLS certified, and I knew immediately she needed CPR. So I dialed 911. I started compressions. They were here within 4 minutes. 3 different firehouses responded, and they took over. And she had 7 rounds of ACLS medication and shocks delivered through an AED. They transported her to Albany Medical Center, which in our area here is the trauma center for pretty much like it's about 100 miles, right? Like
Yeah.
from Glens Falls all the way down to Kingston.
I mean, they really specialize in if you have a head injury or a heart issues. Albany Medical Center is definitely the place you want to go. I mean, it's a big hospital. Plus, it's also partnered with the Albany Medical College.
So it's a teaching hospital.
So
Yeah.
yeah. So basically, think of Grey's Anatomy.
Yeah. It's basically kind of the setup it is. Like you deal with residents and things like that. Yeah, they had a trauma team waiting. They sent out a page to a bunch of cardiologists because she needed to go to the cardiac cath lab. And one of the doctors, his name is Dr. Delago, he responded. He wasn't on call, but he was driving past the hospital, and because at the time she was 45, and they put out cardiac arrest reversal, is what they call it now. And he was amazing. He did her cardiac cath in a flannel and a pair of jeans, and he was the first one to tell us, basically, in the waiting room, me and my family, her family was there, that the Imitrex, which was the medication that should not have been prescribed to her with cardiac risk factors, was probably the culprit. He actually has testified in cases about it. And that's another story maybe we'll make a video about. But she spent 12 days in the CCU. They implanted a SICD, which is a defibrillator, which is here. It's subcutaneous. They do have ones that go here that also do pacemaking, but basically it's here. The wire goes under her breast and up her sternum. So if it ever happens again, it will shock her internally. She would still need probably compressions,
Yeah.
but at least it would try to shock her into a normal rhythm.
It'll shock me until someone either turns it off,
Right.
or my heart fixes itself, or somebody, what?
Well, basically, we would do CPR because you still need to do compressions, and then it would continue shocking her until it got into a normal rhythm, or they decided there's nothing else they can do, and then they would turn it off. Because it's possible with a pacemaker or an SICD for somebody to actually pass away and that thing still be firing, which is creepy. So anyway, because of that, she's followed by a cardiologist, and every 6 months she gets an echocardiogram, which is an ultrasound of the heart that they do from the outside.
Mhm.
And you had that done
Well, I had one
on the 13th.
On the 13th. Part of that was September.
Yeah, she had one in September that was a special one called a bubble echo because she did have a small stroke afterwards from blood clots and being on blood thinners. She had noticed some visual changes. They did see evidence of a previous stroke that they must have happened when we weren't paying attention because I never noticed any stroke symptoms other than the vision thing.
Because after I got home from the hospital,
you were looped.
I was looped, really. I mean, because after the heart attack, I mean, they froze me.
Yep, they did. Cooled you for 48 hours, and then it took 24 hours to warm you back up, and then it was a couple days after that before she really regained consciousness and began speaking.
So.
And she also had 18
broken ribs.
Right. So it was actually 9 different ribs fractured in 2 places from the CPR.
So
that's painful.
Yeah. So I was looped up pretty heavily on pain medication for a couple months after the heart attack. After I got home. So we really don't know exactly when I had the stroke.
Mm-hmm.
But it was around that time that I started exhibiting personality changes. I had lost vision in one of my eyes, which I still don't have peripheral vision in the left side of my left eye.
Yes, this is Calliope.
That's Calliope.
She wants to be in the video. Sorry.
And there's also some balance issues, and I would trip, I would fall. I still was having a lot of trouble speaking, coming up with words, comprehension of things, and like there was a statement that I kept saying. What was it? Something chicken balls and steel walls or something like that.
Weird.
I have no idea what the frig I was trying to say, but I would point at a phone and say, "Give me the lighter." You know, I mean, it was a lot of things were really a big mess. So,
and she did have blood clots in her legs from being in the hospital for so long. That's still something we're not quite clear on why she wasn't on blood thinners in the hospital, but she went home, she saw her primary doctor, her leg was blown up, and they did diagnose 6 blood clots. 1 major one behind her knee, which was totally occlusive, so that vessel is destroyed, and then 5 smaller ones, which put her on blood thinners. The blood thinners could have basically caused a hemorrhagic stroke, and there's really no way to know that for sure because they didn't catch it happening, but that's pretty much what her neurologist thinks happened. So she's followed by neurology, also cardiology, and in September she had what's called a bubble echo. They just wanted to make sure there wasn't a hole in her heart because a blood clot could have traveled from her leg up through her heart, and if there was a hole in her heart, it would have passed through and got to her brain that way, but she didn't. So, and that's been confirmed by now 2 different echoes and that cardiac cath. Yes. So,
so anyway, most recently I just had on the 13th
regularly
scheduled echo, just a checkup, regular follow-up, and they found a mass on the leaflets of my mitral valve.
On the left ventricle side.
And basically they say it's about that big.
I guess what he was trying to get at, maybe a nickel?
Yeah, probably about the size of a nickel.
Yeah.
They think it's some type of calcium.
Mixed with other cells, which is, the fancy term is myxoma.
Myxoma, yep. Because they mix a lot,
Apparently the cells have been, he said the cells have been there since birth.
Possibly. Since birth.
Right. The research that I've done, which is really difficult, and this is another reason we're making this video, and we'll be making a series of videos documenting her journey, is because it's so rare. The myxoma isn't rare in and of itself, but it being on the mitral valve, it being on the ventricle side, and in the leaflets, it's 0.03% of all myxomas in the population like that this happens, and the numbers just keep getting smaller after that. Like in women and at certain ages, it's really really rare. So anybody who maybe is searching YouTube and types in myxoma, they can kind of watch the journey and watch her. You know, we're gonna try to record as much as we can. I don't know how much we'll be able to do at the hospital right away, but definitely when she wakes up. But just kind of our emotions, things we're going through, testing beforehand, kind of how all this came about. I know it was really scary because the day after that first echo, they called her and said she needed to get to the hospital. They initially thought it was infectious endocarditis, because they didn't know what it was. There's something in her heart. So they did blood cultures, a whole bunch of blood tests. We were at the hospital forever.
For 9.5 hours.
I finally went home and got clothes and got stuff for her because they said they were admitting her, and this was on a Friday. And I thought she was going to be there for the weekend and have surgery, and or be on antibiotics. We weren't sure what was going on. And then I got there at like 10 o'clock at night. I left at like 9, ran home, got the stuff, came back, and they were moving her out of her room into the hallway to discharge her. A different cardiologist that we didn't know that was part of the practice basically said that your white cell count was normal. There was no signs of infection, no fever, so they did not think it was that. And they wanted to schedule a more in-depth type of echocardiogram, which is called a TEE, a transesophageal echocardiogram, and that's where they go down the throat. They put you under conscious sedation, they go down the throat, and that
it's
a better picture.
It's a way. It's basically an MRI from the inside. In a way.
Right? Yeah, because there's when you do it from the outside, there's bones, and so they can not get great pictures. So when they go down the throat, they get a much clearer picture. And
they wanted to be able to get a better look at what the myxoma was, what it looked like, what its size was.
Actually, at that point, they didn't even call it a myxoma. They just kept saying mass.
They kept saying mass, yeah. And they also wanted to check out my coronary arteries.
Yeah.
To get a better look to see what my heart really looks like, but. So my heart is clear. My arteries are clear. I have a strong heart. So it's literally just about that they have to get this mass off. And so on August 1st, I'm going to go in, have the open heart surgery.
Yep.
And they'll take that out. And we're hoping, and the doctors are hoping, that they can just repair my mitral valve.
A direct repair.
And if not, then I'll have to have a false valve put in.
There are 3 different types of valves that they can replace it with. One would be a pig, one would be a cow, and the other is a mechanical valve. Because Sandy is only 47 years old, they're putting in, if they have to, it depends on how much damage this mass did. And also, it is considered a cardiac tumor, but myxomas are always benign. So we don't have to worry about this being cancer. We don't have to worry about her needing chemo or radiation or anything like that. So that was a huge sigh of relief, hearing that.
On a side note, I think it's not cancer because I drink so much coffee.
She has that theory.
That's my theory.
The antioxidant coffee.
The antioxidants that are in coffee and iced tea, which is basically all I drink, I have no cancer. Other family members have had cancer, and they don't smoke. I am a smoker, and I don't have cancer. It's because of the fucking coffee. I'm telling you.
So basically, we did film a little out of order, but we're going to upload in order. We did film a little bit before she went in for her cardiac cath, which she had done on Monday the 24th. Yes. She had that done on the 24th. We did a video, and we'll upload that one. Today is day 2 after the cardiac cath. She did really well. We'll make a video about that.
Still a little sore from that, but
we'll make a quick video, kind of just what that process was. I didn't break out the camera because we had some issues in pre-op and post-op, and we'll make a video about that. You know, talking about those issues, but they're not going to happen again.
Nope.
Today we had pre-admission testing. We'll talk a little bit about that in a different video, but and then the day of surgery, 5:30 in the morning, we need to be there. So we will probably
not be sleeping the night before.
Yeah, probably not. We'll probably be pretty nervous and worried. My mom's coming. Her mom will probably come. Probably not like at 5:30 in the morning, but after she goes into the OR, I'm gonna go and be the one back with her in the pre-op area, just because she does have a mild brain injury, and I know her medical upside down, backwards, forwards. Like I fill out all her paperwork,
have anxiety,
and she does get really stressed out, and she can freak out on people. So. But anyway, we kind of just wanted to make this video to introduce ourselves, you know, why we're doing this video. And I just want to do a small shout out. One of the things that inspired me to approach Sandy about doing these videos and this kind of documenting our journey for other people is Shannon Rose's videos in the past couple of weeks. She just went through a tragedy, you know, infertility, and she documented that whole process, the good, the bad, and the very ugly, and you know, to help other people who were going through that so they could see what the process was like. And she thought she was having a miscarriage, had an ectopic, then she had to have surgery to have her tubes removed. You know, I've tweeted with her a little bit, and so just a small shout out to her that kind of inspired me to approach Sandy to say, hey, can we video and document some of this for YouTube so other people who have this really rare thing can see other people, real people going through it, and what the whole process is like before surgery. Some of it we can record, some we can't, but and then, you know, after surgery, and just kind of our thoughts and emotions on the whole thing.
Our thoughts and emotions, and just so people have an idea of what to expect.
And the recovery. We will be documenting the recovery as well in the hospital, and then once we get her back home.
And like, and I also want to do a shout out to my sister-in-law, Trisha Sherwood Tierney. Trisha Tierney Sherwood. Oh, sorry.
She's hyphenated.
She hyphenates it. But she herself was born with a congenital heart defect, and she just had open heart surgery a week and a half ago, and she's 10 days out, and she's doing wonderful. So that gives me hope that I'm going to be doing wonderful, because I certainly don't want to be doing rehab. I'm aiming to be out of the hospital within 8 days.
Yeah, they said 7 to 10, possibly 14, only if like she had a complication. But
I'm aiming for 8.
8 is her goal, so
That's
we'll
my
see.
goal.
And she can be pretty determined. I guess we should probably shout out Olivia a little bit quick. My niece.
Yes.
She was born with a syndrome called heterotaxy syndrome, and she basically was born with half a heart. She has one ventricle in her heart that works, and she had open heart surgery at 9 months. She's going to Boston in August because she has a spine issue too. She's actually really cool. All of her organs are backwards. So her heart is on the other side, everything's on the other side. And she's just an amazing, amazing child. And she's had probably a dozen cardiac caths, so that's like nothing to her. And, you know, she's crying when she gets up, and Olivia's like jumping on the bed after she has cardiac caths. But she doesn't remember her first open heart surgery, and she will need a second stage open heart surgery called the Norwood, which will probably happen in the next year. And it'll be good for her to see you in the hospital and not be the patient. And
Yes.
That's one thing we're looking forward
She's
to.
very used to being the patient.
Yes, and she's been in the hospital multiple times, and she's the one in the bed, and, you know, so it'll be good. And then you guys are going to be twins. You're going to both have this zipper scar.
Have the zipper scar, yep.
So, but yeah, so we just wanted to introduce ourselves and tell you kind of a little brief backstory of what happened and what's going on now. And like I said, we'll try to record as much as we can. We record in the car a little bit on the way to things. And I may not always remember to pull out the camera, just based on whatever's going on, or if I'm upset or whatever. But I'm gonna do the best I can. I'm new to YouTube. We've done some Facebook Live videos, but they're a little bit different.
Yeah,
So
they're different. And so when it comes to Facebook, like after anybody who watches this, if you want to friend request me on Facebook, I'm just Sandy Beach. Look me up. I look like this. I'm not hard to find.
Jeannie Beanie Beach everywhere. YouTube, Twitter,
But
Facebook.
it would be. I think it's like Facebook/One Funny Chick is what my tagline would be if you wanted to search me that way.
Because you can't change that, right? Yeah.
No, can't change that. So, but I'm a public figure, so my page is public. I will pretty much accept just about anybody's friend request, and I'm an open book. You have any questions, you can talk to me, message me, whatever, Yep. So.
All right. So
Alrighty.
yeah, look for more videos. We will upload as we go along, and there is Wi-Fi in the hospital. So I will try to do every day, like maybe after the doctors do rounds, and when she's in the hospital, the nurses kind of rely on me to keep her calm and things like that. I could barely get away from her some of the time.
Because when I am drugged and confused, I become combative.
Yeah.
Violent. Like apparently after my heart attack, I kicked a tech across the room.
Poor Gretchen. I never
sorry,
saw her
Gretchen,
again.
I have never met you, and if you ever wind up seeing this video, this is my shout out to say I'm really sorry. Yes, I am.
All right, so we'll do some more videos, and on August 1st, that day will probably be hectic. And she'll be in the ICU for 2 days. I may not upload that whole surgery day and ICU videos until the 3rd, maybe, just depending on what's going on. Unless I have downtime and she's just on a vent doing nothing, then I might upload. So, but I'll try to do day to day as I can. At least if she's really not doing well and I don't feel like she should be on camera, or she's not with it enough to be on camera or whatever, I may just jump on and do a quick video giving you guys an update. Doctors will be doing rounds in the morning and then in the evening at 5.
And I'm gonna give so that there's proof of the permission. Like if I am being silly, doing something that's really
you
odd
don't
or
care.
stupid, I don't care. Yes.
What about when you're
it.
on the vent?
If I'm on the vent, that's fine.
Okay.
You can document some people because that's part of this.
True.
You want people to know. We want people to know what to expect. So
Okay, then
I'm an open book. I'm allowing for you to video anything, including the last time. Apparently, at one point, her and my stepdaughter had left the room, and then they had come back, and I had been allowed to be sitting up in a recliner, and they came in, and I guess I had been spinning around in circles.
Because only one brake worked on one side, so she was moving her foot like this.
Moving the foot,
she had
pushing,
her IV twisted around her.
And I do really silly things.
But
like,
I will...
on stage, I do it on purpose. When I'm medicated, I do it by accident, and I don't mind making an ass of myself.
But I will. So. I'll try to at least get a few minutes of video. That first night is going to be like one nurse there watching her like a hawk. But if I can, I'll try to at least go through her IV pumps and what medications she's on, why she's on them, vent and things like that. All the things she's hooked up to, just to give anybody else who might be having open heart surgery for any reason kind of an idea of what that looks like, and then day by day as she gets better, so I think that's about it for now.
Yeah, that's about it for now.
All right, so look forward to more of that, and then after this is all over, we might just continue vlogging our crazy little life, because there's a whole lot more going on in our life that's coming up, and we can be crazy, and it's very interesting.
This is my shocked face. This is my, I don't want to have to deal with that stress face. That's what that is.
It's coming. It's going to be okay, though.
It's a good thing I'm having open heart surgery, because if I wasn't, the stress would probably kill me. But anyway, Yes, Callie. Here, look.
All right, here we'll
Look.
introduce you. This is Calliope. Yes,
Calliope.
our little pitty, and she whines and cries when she doesn't get attention. And this is
There, that's... Oh, keep turning, keep turning.
keep turning.
Can't... Oh, there's Theodosia. It's a baby girl.
She's some kind of mutt. Her mama was a pit bull.
She does not like when you call her a mutt. Look at that.
All right, so we're gonna sign off for
You should
now.
be.
I'm probably gonna upload this on my channel, and then we can link it as like a favorite or whatever over on Sandy's channel. Just because I'm doing this from my phone right now until I figure out how to hook up my Nikon camera and we get a better setup. I apologize if lighting is bad. Like I said, I'm new. But there's people that I follow on YouTube that I'm sure maybe would give me some tips and tricks. So, all right, we're going to say goodbye. Say goodbye.
Goodbye.
Bye.
Blah.